Hello, I'm Dave Dawes. I'm the Learning Director at Future Care Capital.
And I'm Patrick McGee, Professor of Psychology and Private Psychotherapist.
And the purpose of this course is to look at how to support you in caring for someone with depression and anxiety. Just a little bit about our backgrounds. I'm a nurse. I've also cared for both of my parents when they were ill, and I've had quite a lot of professional and personal experience around people suffering from anxiety, depression and other mental health issues.
My first engagement in mental health issues goes back to 1986-87 when I worked as a research fellow in psychiatry at St George's Hospital, University of London, and I've been teaching and doing research in mental health and adult relationships ever since. More recently, I've been fully qualified as a cognitive behavioural therapist, and I run a private practice, and I've been doing volunteering in the Greater Manchester area for about 4 or 5 years now.
Okay, so I suppose it probably helps start off with sort of what do we mean by anxiety and depression, just because those are terms that people use an awful lot. So.
Yeah. Well, there's clearly a lot more awareness now than there was even 5 or 10 years ago around anxiety and depression. I think the first thing we can say is that we need to distinguish between everyday sadness and feeling upset about things not going well in our lives, maybe not getting a promotion at work or
relationship
breakdown. Yeah,
problems, that kind of thing.
Absolutely. Those things are distressing and upsetting. It's human nature. It's the way we are socialised. It's in our genes to have a negative reaction to those situations. But most of the time, most people kind of bounce back.
Okay.
They're able to cope. They've got friends. They've got ways of dealing with things. They look about the future, about what the options are, and they get back on track, as it were. In depression, in a clinical sense, where we have a severe depressive episode, it's an individual who does not feel able to get over that challenge. They feel that they have lost meaning in life. They're very low mood, very sad. There's a lack of energy. There's a real sense of not wanting to leave the house in the morning, not want to discover new things. These are common characteristics of what we might call a clinical depressive diagnosis. But many people feel depressed in a very severe way with no identifiable causes.
So there's no obvious trigger?
No obvious trigger at all. Depression comes in many, many different shapes and sizes. In terms of anxiety, clearly everyone has worries. Everyone's unsure about the future. Our brains are wired to think about what's new, what's coming up, what might be a threat, what might be something we can cope with, what might be something we can't cope with. And our brain keeps wanting to think about, what will I do if? What if that happens? What will I do? And that can sometimes, in important situations, maybe a forthcoming exam or a driving test or uncertainty in moving house or jobs or relationships, we feel anxious. But in the clinical sense, in terms of severe anxiety, this tends to be more severe, tends to be longer lasting, and tends to have knock-on effects in terms of the way the person sees the world generally and the way they react to other people. They become more pessimistic, more anxious about what might happen, and spend a lot of time ruminating, just thinking about what if, and that chasing of the possibilities about what could go wrong itself becomes something that the individual worries about. So quite apart from the possibility of, say, losing their job, the sheer burden of worry itself becomes something significant and substantive, which causes them anxiety of a meta level, as you were. So it's important to recognise that there is upsetting things and worrying things in our everyday lives, and we tend to deal with those things, sometimes better than others, but there is a severe form of depression and anxiety which needs to have a recognition in the family, in relationships, probably needs some kind of professional support, and that's where we want to try and improve things better across the country.
Okay. And I think one of the things we should emphasise is this programme is about supporting someone with anxiety and depression. That might be the primary issue that they're having. So it might be that they see themselves as that their main issue is either anxiety or depression. But often it can be associated with other issues. So it might be that someone has dementia and they're very anxious about it, or they might have a cancer diagnosis and be depressed. So it's quite common that anxiety and depression will also be associated with other issues and other conditions. And hopefully what we'll do is we'll give you a range of tools and techniques for kind of both recognising it, working out what you can do to support, and more importantly, when and where to get outside help to support you as a carer.
Absolutely. I think nowadays, because there are many more opportunities for tests on physical ailments, we're much better now looking after chronic ailments. People are getting better quality care, but you're absolutely right. The psychological dimension of long-term chronic physical illnesses is often overlooked. And we shouldn't forget that although individuals can be suffering from anxiety or suffering from depression, very often the two things go together and in a sense feed each other. Round about 40 to 50% of people who have severe symptoms of anxiety will have severe symptoms of depression as well, and vice versa. So it's important to recognise that triangle, as you say, of the physical or other health issue alongside the anxiety, alongside the depression.
I hope you found this course helpful. At FCC, we're committed to providing courses and training for unpaid carers, and these courses are completely free. If you found this helpful, you could support our work in 3 ways. Please recommend it to any friends or people that you know that will benefit from the courses. Please consider sharing it on social media. And if you can, please consider donating. There are buttons on the website where you can donate £1, £2, £5, and every pound that you donate will make a huge difference by helping us make more and more care courses completely free to carers. Thank you very much.